everybody just wait up in front, please. Thank you very much. We don't fight.
Because I'm coming from the Amharic temple, I'm here to really set a better example. So make me touch you by your dimple, I'm up in the temple. Come see coming from the Amharic temple.
All right, thank you very much. So again, good afternoon and welcome to our health symposium under the theme Empower Her, Screen, Prevent and Protect. We're so glad that you could join us. And I want to, at this time, invite our financial controller, Mrs. Shari Hooper-Scott, to open us in a word of prayer.
Let us stand for prayer. Loving God, we give you thanks for this day. Father, we come at this time to seek your blessings upon this symposium. I ask, dear Lord, that you will bless all the hearts that have been come to receive what is to be shared with us. We pray in a special way for the presenters and ask, oh God, that you would give them clarity of thought as they present these information to us. I pray for every individual seated here that you will give us focused minds, oh God, and help us that whatever we would have learned today, we will take that information with us to empower other women who would have been absent from today's proceedings. We thank you for this institution, dear Father, who have the vision to see the necessity for such a conference. And we ask, dear Lord, that you will touch every hand that would have worked together to get this, to make this evening a success. All these we ask in your blessed name. Amen.
Amen. Thank you, Mrs. Scott. You may have your seats. At this time, we want to invite our marketing manager, Mrs. Melissa York-Nichols, and she will do the official welcome.
Good afternoon, everyone. It is such a pleasure to welcome you on behalf of the management and staff of the St. Vincent and the Grenadines Teachers Cooperative Credit Union to our 5th Annual Health Symposium. This year, our theme is Empower Her, Screen, Prevent, Protect. Shines a light on something that touches so many lives, cervical cancer. Today, we are here to learn, to share, and most importantly, to encourage each other to take our health seriously. At SVGTCCU, we believe empowerment isn't just about finances. It's about caring for the whole person. We want our members and our community to live well, stay informed, and feel supported. So this afternoon, let's take time to listen, ask questions, and spread the message that screening saves lives. Prevention is possible, and protecting our health is one of the best gifts we can give ourselves and our families. Thank you to everyone who made this event possible, our partners, our presenters, and all of you who took the time to be here. Together, let's continue to empower her, to screen, prevent, and protect. Thank you for being with us this afternoon. And before I leave, I just wanted to give you an official sort of insight as to how the afternoon will flow. We are going to have presentations from our doctors, and then we will then open the floor for question and answers. And if you are viewing us on YouTube or Facebook and you have a question, please enter it in the chat and it will be answered. Once again, welcome and thank you for being here with us this afternoon.
Okay, thank you, Mrs. Nichols, for that welcome. All right, without any delay, we are going to move quickly into our first presentation. And I want you to help me to welcome Dr. Camille Nichols, who is a proud Vincentian. She has dedicated her life to service in the field of women's health. After postgraduate training in the United Kingdom, she returned to St. Vincent and the Grenadines and was appointed consultant obstetrician gynecologist in 2001. She is now head of department of the obstetrics and gynecology unit at the Milton Cato Memorial Hospital. On the 1st of June that same year, Dr. Nichols opened her own practice at Victoria Medical Center, which recently celebrated 24 years of quality service on June 1st, 2025. We could put our hands together for that. So in 2006, Dr. Nichols was inducted as a fellow of the American College of Obstetricians and Gynecologists, and in 2011, she was admitted as a fellow of the Royal College of Obstetricians and Gynecologists. Dr. Nichols is an advocate on women's health issues and readily accepts requests to meet with institutions like ours, women's organizations, church groups, and school children, empowering them with knowledge and information. So put your hands together and help us welcome Dr. Camille Nichols.
Good afternoon to all, those of you who are here physically and those of you who are joining us on social media. I want to say thank you to TCCU for inviting us to be part of their ongoing health awareness program. I want to say thank you especially to Ms. Huggins for always wanting me to be part of this program. I am humbled. Let me say I want to encourage you guys to continue with these health segments as you continue to educate your members and also the population of St. Vincent and the Grenadines. Your chosen topic, Empower Her, cervical cancer awareness, is an important one as we in St. Vincent and the Grenadines launched our cervical cancer elimination program last month. Dr. Baptiste Sylvester, who heads this program, will enlighten us in a few minutes. Cervical cancer is the fourth leading cause of death in women globally and the second leading cause of death in women in St. Vincent and the Grenadines. Cervical cancer is the growth of abnormal cells in the lining of the cervix, or what we call the neck or mouth of the womb. The most common type of cancer being squamous cell carcinoma. It has now been established that the cause of cervical cancer is the human papillomavirus, HPV. We know that it is caused by sexual contact, whether it's oral, anal, vaginal sex with a person who has this virus. Fact, no woman, especially no woman in St. Vincent and the Grenadines, should get cervical cancer, and therefore we should have 0 deaths. Why? There is an international established screening system in the form of the pap smear, in that if we women have our pap smears done and precancerous changes are detected, then the healthcare providers will be able to refer clients for treatment modalities that will prevent them from progressing to cervical cancer. The Ministry of Health, Wellness and the Environment, in collaboration with PAHO and the University of Miami, are now introducing HPV DNA testing, which is far more sensitive than the pap smear, and Dr. Baptiste Sylvester will expand on this. The figures from the pathology department at our hospital show that over the past 5 years, 2020 and 2024, 55 women were diagnosed with this terrible cancer, 8 in 2020, 9 in 2021. 2022, we saw 12, 2023, we had 9, and last year we had 17. The youngest person was age 22. She was diagnosed in 2023, and she succumbed earlier this year. And this September, we lost 3 women, and I think they were all under the age of 50. So we have to do our pap smear, and cervical cancer, death from cervical cancer is very, very debilitating, and it's heart-rending to see women dying from it. Because at the end of life, most of them coming to hospital, we have to take care of them, and it's very, very, very heartbreaking for us as healthcare providers. Our role as healthcare providers is to reach every woman in St. Vincent and the Grenadines, educating them about pap smears and the HPV DNA testing and the importance of being screened. I'm going to hand you over. Well, Dr. Batiste will come soon, but please listen to what she's going to be telling you, because we have to empower ourselves, we have to educate ourselves, and we have to take charge of our lives. Thank you.
Okay, thank you, Dr. Nichols, for that presentation. This time we will hand over to Dr. Damaris Batiste Sylvester, who is a consultant obstetrician, gynecologist, and gynecological oncologist at the Milton Cato Memorial Hospital. She also has a private clinic at the Victoria Medical Center. She is very passionate about women's health, empowering women with knowledge and understanding about their bodies and what may be happening to them. She is actively involved in outreach ministry and has dedicated her gifts and talents in service to others. Please help me welcome Dr. Batiste Sylvester.
Thank you very much for the warm introduction. Just so that I could handle myself a little bit more, I too join with Dr. Nichols in congratulating the TCCU for this outstanding program initiative. I always find it a joy when institutions take pride in health and also, by extension, the women of St. Vincent and the Grenadines. So we will move right along into this presentation. Our focus, our goal is to learn everything we can about cervical cancer. Now, I want you to do this exercise with me. Just close your eyes and just imagine for a minute that we could potentially eliminate cancer. Just imagine there's no more cancer. Specifically, I see somebody with their eyes open. Just specifically, we can eliminate cervical cancer. Do you think this is achievable? Open your eye and respond to me. Do you think this is achievable? Come on, you have to say it with meaning. Right. So no, you see that conviction that you just held or hold, where you say that we can potentially eliminate cancer. Now I need you now to become champions of this message that I will now bring to us. Next slide, please. All right, so the objectives today, we're just going to talk briefly about what exactly is cervical cancer, the causes of cervical cancer. We're going to look at how we can prevent cervical cancer, primary prevention and secondary prevention, and then lastly, a taboo topic, and feel free to ask all your questions about this, the safety and efficacy of the HPV vaccine. All right, so we're gonna spend a little bit of time looking at the data and trying to understand, is this safe, is this not safe, as I'm sure a lot of you would have questions about. Next slide. All right, so this is a schematic or a diagram of the female reproductive tract. You can see, and Dr. Nichols will help me point, you can see there are 3 layers that comprise the uterus. There's the top layer. The innermost layer is called the lining of the womb or the endometrium. Then there's a more muscular layer just outside of it, and there's a nice shiny layer on the outside. Now, if you look lower down, we locally call this the neck of the womb or the birth canal. This is what we call the cervix. So imagine a child is growing in the uterus. The child grows in the lining of the womb, and when the child exits the womb into the external environment, it will pass through the cervix, out into the vagina and into this wall. So everybody now knows what the cervix is? Can you see your cervix? Yes or no? So we know what the cervix is? If you don't know, raise your hand so I could explain a little better. Okay, so we know what the cervix is. Next slide, please. Because in order to know what you're preventing in terms of the cancer, you have to know what the organ is, So this is a better diagram. Now, as a healthcare professional, for us to access the cervix, we have to place an instrument called a speculum for us to see it with our direct eyes, right? We have to place this instrument through the vagina. We open it up, and that process of opening it up separates or pushes aside the walls of the vagina, so then we could see the cervix. This is what we will tend to see. Right? And this is potentially what a normal cervix can look like. This is the opening I was telling you about when the baby comes out. This is called the cervical os. And this is the area along this lining right there where two different types of cells potentially meet, and that is the area where cervical cancer can arise from. Next slide, please. All right, so what is cervical cancer? Now, abnormal cells in the cervix begin to grow uncontrollably and can invade or penetrate surrounding normal tissue. Now, what is around the cervix is you have a filmy layer that is called the parametrium. You have the vagina. Above, you have the uterus. You have the rectum that sits behind the vagina, and you have the bladder that sits in front. Now, when these cells start to move or rapidly grow, they can invade these surrounding areas. As it grows, it can spread to distant areas in the body. I just mentioned some. And cancer cells can also spread via the lymphatic system, which is the system that drains, purifies, and filters blood, and it can also spread via blood. So sometimes you see people with spread to their lungs, to their brain. It can originate from the cervix, and it spreads via these channels, the lymphatic, the blood, or just direct. So it keeps spreading and spreading. It goes from pelvis to abdomen, then it goes up, and that is what potentially will kill the patient, or that's what we call advanced disease when it starts spreading out to surrounding structures. Next slide. Now, this slide talks about the global cervical cancer mortality. Dr. Nichols gave us an idea of the stats in St. Vincent and the Grenadines. Worldwide data tells us that 90% of deaths from cervical cancer occur in low and middle income countries, and St. Vincent is no exception. Now, cervical cancer is a cancer that is already eliminated in most first world countries, such as Australia, even the US. The statistics, they are really, really low. Yet we see the Caribbean with all these high figures. Now we're in 2025, and already we've diagnosed 19 patients, right? And from these 19, half of them are already dead. Because this is a cancer that people don't pay attention to the warning signs. And therefore, by the time they show up to the doctor, the cancer is so advanced, now we have to try to fly them out of St. Vincent to get chemo radiation, and this can cost in excess of $40,000 to $50,000 US. And as Doctor mentioned, the patient suffers drastically. You can imagine now cancer spreading to your bottom, cancer spreading to your bladder, to your bone, and you're suffering such a painful death in a cancer that is potentially one that can be eliminated. So it's very sad and it's heartbreaking for us. So we really need to get the message out that there's something we could do. Next slide. So what are the symptoms? Let's talk about that. If a person develops one or more of the following symptoms, you need to see a healthcare provider. Don't sit down and watch it and see if it will get worse. Don't sit down and say you're going to push garlic up in your vagina, or cinnamon, or bush. Don't do that, because the longer you stay, the more we are helpless to give you the help that you potentially need. And we are telling you, people do these things. They smell an odor, they prefer to put a whole head of garlic up in there instead of seeing the physician, right? So what are you looking for? Now, I am not saying if you have any of these symptoms, you're going to walk out of here and you say, Lord of mercy, I have cervical cancer. Right? I'm not saying that. What I'm saying is, if you are experiencing any of these symptoms, please see a healthcare provider. It is just a signal that something can be potentially wrong. Do you follow me? Great. So 1, you're having vaginal bleeding after sex. No, I have heard patients say, if you don't have pain after sex, or if you don't see little blood, the sex ain't good. Now, make nobody fool really here. That is foolishness, right? So if you're seeing vaginal bleeding after sex, please see a healthcare provider. If you are seeing bleeding after you experience menopause, so you had 1 whole year, you never see any blood coming from down there, and then all of a sudden you start to see bleeding, see a healthcare professional. If you are bleeding in between periods, so what do I mean by that? Your normal cycle is supposed to last 5 to 7 days. You have had a period, and then 2, 3, 4 days, you start spotting, bleeding again, see a healthcare professional. Next, you're having a watery discharge with a strong odor or a bloody discharge, please see a healthcare professional. You have pelvic pain or very intense pain, or even pain during sex. Sex is not supposed to be painful. So if you experience any of those things, please see a healthcare provider. It's difficult to pass stool. Your bowel movements are painful, or every time you have a bowel movement, you're bleeding, see a healthcare professional. Painful urination, even blood in the urine. And also unusual abdominal pain. Some people can't describe it. They're going to just say, it feels real heavy down there all the time. Or it feels like a dull ache. It's not intense, but it's going on despite little paracetamol or Voltaren. It's persistent. Please see a healthcare professional. Now, what is the culprit? What is causing all of this? Now, if a cancer potentially can be eliminated, that means we have enough information, we would have studied it well, and we know exactly what to do to prevent it. Now, in the studies, as Dr. mentioned, the culprit is the human papilloma virus. What is it called? Human papilloma virus. And this is a virus that women can contract, and men can contract it too, during sex. It's a sexually transmitted infection. This virus tends to infect cells in the genital region and also in the mouth. And when it gets into these cells, it uses the cell's DNA to continue replicating. So it finds its way into the cells, and the persistent infection with certain high-risk strains of the HPV can then lead to cancer. So it's not because you have you get HPV today, that means you will get cancer tomorrow. It takes a while for the transition from infection to actual cancer. Potentially, it can take about 10 to 15 years. So that is why it helps us if we could screen, because we know it takes a while. If we are regularly screening, then we could pick up abnormal changes, or we could even pick up the virus and do something about it before it starts invading, infiltrating, and potentially get to the point of cancer. So if you look at this diagram here, you could see Once HPV gets into the cells, you don't just transition to cancer. You have abnormal changes that could potentially start occurring in the cell, and we call those changes low-grade squamous intraepithelial lesions, which could range from, as the word says, low grade to high grade and then to cancer. So low grade means that only a percentage, 1/3 of the cell is infected. And high grade means the abnormal changes have spread to more than 50% and almost the full thickness of the cell. When it becomes cancer is when it breaches the cell wall. So potentially we can detect abnormal cells before they become cancer, and we can treat that. Okay, let's move on. So the human papilloma virus, it causes nearly all cervical cancers. Now, 99% is what the data is now showing us. This virus can also, right? And it is prevalent, right? Meaning it plentiful, it about enough, right? So it means from that data, we've recognized over 30% of our female population between the ages of 30 to 60 will be positive for HPV. So we have the risk factors. We are small population, right? More than likely, I should say this. I was going to say more than likely, when you have sex with an individual, we are not seeing that you might have a virgin man and a virgin lady, right? We're seeing individuals who may have more than one partners in their lifetime, and that would increase the risk of contracting HPV. So in our small population, if 30% have this high-risk strain of HPV, you could imagine how much HPV is currently on board and around right now. So I say that to say, Doctor spoke about the cervical cancer elimination program that was launched. We started now screening for HPV in 4 districts in St. Vincent and the Grenadines. HPV DNA testing is available to everyone privately at Sigma and CRL. However, it is a little pricey because the machinery that we need to actually isolate the HPV is expensive, and the test roughly costs privately, just to get the test process, HPV only test costs around $300, right? Now, the government recognizing that this HPV DNA testing is something that could potentially help people partnered with PAHO. And they have started introducing testing in 4 areas. Now, within the next 6 months, we are hoping to upscale to the length and breadth of St. Vincent and the Grenadines, where the test will be available to everyone in all the health centers. I say this to say, from the little data we've done, we've analyzed so far in terms of the testing, and this testing has just started 1 month ago. The little data we are seeing, the prevalence continuing to be 30% roughly. So even right now, these high-risk strains, they are prevalent. And if they are prevalent, we need to be aware of the importance of screening. Now, if an HPV DNA test is not easily accessible to you, Doctor spoke about doing your pap smears. What the pap smears do now, they look for abnormal cells. So after we take the sample, instead of trying to screen and look for the virus, the cytologist or the person who processes the sample, they look under a microscope for any abnormal changes that could potentially be on board, and then you are offered treatment if any abnormal cells are located. So there's no excuse why we can't get any form of screening, whether it's HPV test or whether it's the pap smear. Now, the little good news I had to share was that if you are between the ages of, let's say most persons start having sex by 18, roughly, right? If you're between 18, Dr. Smile, because she know plenty will start way younger than that. Say, roughly you started having sex between 18 and 30, right? In that age group, I guarantee you 80% of you will detect HPV or will have HPV, right? That's how frequent and rampant this virus is. The good news is by the time you are ages 30 and above, your body would have naturally cleared the HPV. When we do get concerned is if the HPV is persisting beyond age 30. That's why it doesn't make any sense for us to do HPV screening if you're 30 years and younger, because we know the data tells us 80% of women will be positive. So therefore, we wait to see if their immune system will naturally clear the virus. If not, and it's persisting, that's when we get concerned and offer treatment. All right, let's move rapidly. Next slide. All right, so the risk factors for HPV, early age at first intercourse, multiple partners. If you are immunosuppressed, whether it's by HIV, organ transplant, or just medications that you're on, smoking, and just a disclaimer, condom usage can prevent infection. So those are the main risk factors. So as physicians, we ask you a little bit about your history. Many of you would be asked similar questions to this. How old were you when you first had sex? How many sexual partners you had in your lifetime? Not because we want to know your business. It's because we are trying to risk stratify you to then determine if you are at a higher risk for having a sexually transmitted infection. And if that is the case, your physician may ask you to come back after a year to get another pap smear instead of saying, wait 2 years, wait 3 years, etc. So it depends on your risk factor. Some persons, they may come back to the doctor the next year and they may say, well, I changed my sex partner within the last year. Doctor may opt to say, well, yes, let me screen you more regularly. Let's move on. HPV in men, and I see some men here, and I'm very thankful for men who showed up, because whatever affects the woman will affect you indirectly. And also men, you get the HPV, but you are not as symptomatic with HPV as a woman. So we tend to call the men the carriers. They carry the virus, but they get to live a life that is wonderful and blessed, right? Because penile cancer, which is cancer of the penis, is so rare. While HPV causes it, it's not as common as cervical cancer. But you still need to be aware. HPV affects penile, oral, and the anal mucosa. We can't screen men for HPV, right? Just like we have the screening test for women, there's no penile screening available in men. But for our men, especially if you have no fertility desires and you know you had a history of multiple partners in the past, please wear a condom, right? Because the studies have shown that the high-frequency use of condoms can reduce the risk of infection. Next slide, please. All right, next slide again. Spoke about this before. Let's move on. So currently, we spoke about the screening methods in St. Vincent and the Grenadines. We have primary HPV screening. This is now the preferred method. If it's something that is not affordable, you may opt to have the pap smear, okay? Your physician may offer you a pap smear with or without HPV testing. You can do both. And depending on if you're HPV positive or not, you may be offered further testing such as VIA, which sprays some vinegar, diluted vinegar, onto the cervix to highlight abnormal cells. And if abnormal cells are highlighted, we can then offer you treatment. Okay? So these are the screening methods that are available in St. Vincent. Why is screening important? HPV is the most common sexually transmitted disease in the Caribbean. 80% of women contract HPV in their lifetime. The immune system can clear or suppress the infection. In women diagnosed with cervical cancer, 50% of them have never been screened, right? Most times they ask, when was your last pap smear? 20, 40 years ago, etc. Not acceptable in this day and age. And 10% of these women did have a pap smear, did have a pap within 5 years of their diagnosis. So I say this to say, sometimes the patients that we are seeing that are lately diagnosed, they didn't have a pap smear within the last 5 years. So it's something that we recognize. One of the main risk factors is they just chose not to have any testing, any pap smears, nothing at all. Screening allows us to identify the precancerous lesions early to treat those at risk for cervical cancer. You get the point of why screening is important? All right, great. Let's move on, Doc. All right, now, that was secondary prevention. So we are screening, something is detected before it gets to the point of cancer, and we intervene. Now, there is another modality that is just as powerful that could help with preventing cervical cancer, and this is what we term HPV vaccination. Ladies and gentlemen here, the vaccine works, right? The vaccine has been known to prevent cervical cancer, eliminate cervical cancer in most first world countries. Australia right now is on the verge of completely eliminating cervical cancer because they've introduced HPV vaccine in their schools immunization program, right? And we have had a lot of data to study because the vaccine was first introduced in 2004, right? So that is over 20 years of data that we can now look back and study to really know if this truly works. It's not like the COVID virus that just came out the other day and then a vaccine was created in an effort to help, but then it wasn't tested and tried. It wasn't around for a long time. The HPV vaccine has been around over 20 years, and we can look at multiple studies that look at the side effects, that look at whether the persistence of HPV got less or more, and we could see from analysis of the data and various studies and trials that the vaccine is effective. So how does it work? It works by triggering the immune system to produce antibodies that protects against specific types of HPV, preventing infections and related diseases. It's very effective in preventing precancers and cancer. Now, looking at the side effect profile, and everybody is concerned about that. What are the side effects? The data shows that the serious side effects are rare and almost non-existent. 0.01%. It's just as all the other vaccines and their side effect profile. That is really what the HPV vaccine side effect profiles look like. Now, what is the recommendation? The earlier our boys and girls start getting vaccinated, the better. The reason, we want to be able to vaccinate them before they become sexually active. The decisions you make for your child ages 9 to 14 will bear fruit by the time they reach in their 20s and now ready to be sexually active. So if you start vaccinating between 9 to 14, the immune system is armed, it's triggered. There is an immune defense that starts building up throughout the years. The earlier you start vaccinating, the more robust that immune response will be. Right? So if you wait until you are later, like in your teens and in your 20s, or even after you have become sexually active, the effectiveness of the vaccine will not be great. Do you follow? So parents with children between the ages of 9 to 14, we are not saying vaccinate your child to have sex, right? Obviously, that is not the goal. That is not the reason. We are saying vaccinate your child between ages 10 to 14 so they could launch such a robust immune response. So by the time they are in their 20s now, the effectiveness will be high. That is the reason for encouraging the vaccine. Now, as I mentioned, the vaccine can still be given up to the ages of 45, but the effectiveness drops once you start having sex. So the target is to give the vaccine before the children start having sex. Let's move on. And this is all trials that I put there just to let you know, and I'm talking from this side of my mouth. It's tested, it's tried. We can't go through every one of them now, but these are all of the studies that have been done. Future Trial 1, Future Trial 2. These are the years when they were done. These are how many women they've studied who are all vaccinated looking for side effects. All right, let's move on, Doc. This is telling us a bit of data before the pre-vaccination era, what the stats were like, and then looking at the prevalence in the vaccinated, you can see how the numbers drastically fell, right? So we know, I can tell you the facts that the vaccines truly work. Let's move on, Doc. Move on again. Move on again. Oh, just go back one, Doc. Right. So looking at all the studies that I mentioned, right? And you can see how many patients were reviewed, right? 14,000 adolescents. In another instant, they look at persons that receive 23 million people. They even look at pregnant women who are vaccinated. And if you look at the adverse effects, you can see that it really is just as any other vaccine. The most common is a little redness on the site. Some people might have a temperature, but there's hardly any rare side effects. Let's move on, Doc. All right, so before I conclude, I just want to debunk some myths. Number one myth you're hearing, even in our own population in St. Vincent and the Grenadines, I'm hearing it. People are saying the vaccine is unsafe. I gave you the evidence why it is considered safe. So this is a myth. I need you now to go out and help me to debunk. People are saying you can get HPV from the vaccination. Foolishness again. The vaccine does not infect you with HPV. It protects you against HPV. Vaccine increases risky sexual behavior. Whether we give 10 vaccine, whether we give 20 vaccine, whether we give no vaccine, who wants to have sex will still have sex. You agree or disagree with me? All right. Only females should receive the vaccination, another myth. The vaccine is tested and safe for both boys and girls. Pap smears make the vaccine unnecessary, not true. Even if you get vaccinated, you still need to be screened because while I said cervical cancer is HPV accounts for nearly all cases of cervical cancer, you still have a 1 to 2% cases of cervical cancer that is unrelated to HPV, and so we still encourage individuals to screen. The vaccine does not lead to infertility. That is a myth. You will still get pregnant, you can still have children. If you're not getting pregnant, it's not the vaccine cause it, okay? It's a different issue and you need to be worked up for whatever that issue is. Those who are vaccinated don't need screening. Again, we just spoke about that. You still need screening. Cervical cancer is the only cancer that the vaccine prevents. We learned about anal, penile, throat cancer. The vaccine can also prevent those types of cancer. So whenever you hear anybody talking about those things and you know it's foolishness, stand up and defend because it is important you get the message out. It is estimated that if vaccine rates reach 70% worldwide, if we reach that vaccine uptake rate, we would expect to see a decrease of 344,520 new cases of cervical cancer annually and avoid 178,182 cervical cancer-related deaths, right? If only people would agree and understand the importance of the vaccine. So in conclusion, cervical cancer theoretically should no longer exist in St. Vincent and the Grenadines. Primary and secondary prevention is key to eliminating cervical cancer. HPV is the primary cause. If you don't remember nothing else I say, remember this slide. And screening should focus on HPV detection when possible, but alternatives such as the pap smears, they are available and more easily accessible. HPV vaccination is safe and efficacious. Women and men can still get the vaccine up to age 45. Ladies and gentlemen, thank you very much. You've been great.
Okay, thank you very much. We can do better than that. Put your hands together for Dr. Baptiste Sylvester. All right, so we've come to a very important part, the questions and answers. I'm sure you guys have a lot of questions. Hopefully you have some questions. We have the mic in the center, so if you have any questions, you can just go there and we will acknowledge you and give you a chance to speak. Okay, so I will get the ball rolling. I had a lot of questions, but I must say that was a very, very thorough presentation. So I might have to throw my little questions aside. But the first question would be, what advice would you give to a woman who is hesitant or fearful about getting screened?
I hand over to the wealth of experience here.
As I said earlier, cervical cancer is preventable. And if it's preventable, we should, as women, find the ways to try and ensure that we don't develop cervical cancer. Unfortunately for us women, we can't see our cervix. The man could look at it, he could hold it up and down. For us, our cervix is inside. We cannot see it. If you get a cut on your hand, right, you would see it festering and you will go and get it sorted out. Not so with the cervix. We need to know that we have to screen in order to prevent cervical cancer. A lot of people go online and they read up and they see they say, do your pap smears every 3 years. You have to know what's happening in your community, your country. Doctor just told us 30% of women will get cervical cancer. I am sure we have 20 women inside here, which means that 6 of us, if we not take care of ourselves, will get cervical cancer. Because if we have 30%, that is 3 in 10, yes? So 6 of us will get cervical cancer if we don't do our screening. It doesn't take a long process, even if we're doing the pap smear or the HPV. Less than a minute to do a pap smear. And a lot of women say after finish, oh, how come everybody tell me it was so difficult and so hard? It's easy. It's a little bit intrusive, it's a little bit cold, but a pap smear or your HPV testing is all we need to do, and we just have to do it.
And just to add to what Doctor is saying, I always tell patients 15 seconds of discomfort can prevent a lifetime of pain. So don't gamble with your health. Take the 15 seconds. Nobody telling you it feel like a scratch back or a hug up, right? We're not going to lie to you. It's a little uncomfortable, right? It should not be overly painful, and just purpose in your mind. Just 15 to 20 seconds of discomfort will save you a lifetime of pain.
Okay.
And not just a lifetime of pain, financially too. Yeah, because if you have to go to Trinidad, it's 60,000 TT dollars you're looking at. US, sorry. 60,000 US dollars. That's house and land for persons. Yes?
Okay, do we have any questions from the audience? Okay, we have someone.
Thank you. Good afternoon, everyone. I have 2 questions. One, I'm under the age of 30. I do my pap smears. Do I still get tested for HPV, or do I have to wait until I'm 30?
Yes, so you have to wait until you're 30. The recommendation will just, the recommendation is that you screen for HPV over 30. Mm-hmm. If you do it before, it's either because you're HIV positive, overly high risk, and that can tend to lead to over-treatment because it's so prevalent. We prefer to wait until your body will naturally clear it. Okay?
And my next question is there a treatment for HPV?
Yes, so there's a whole protocol that we have launched. Not necessarily we're treating HPV, we are treating the cervix, because HPV can tend to be around, but we can do things such as ablation, cryotherapy, if someone has high-risk HPV. The aim of that is to destroy, thanks Doc, is to destroy that area where cervical cancer tends to come from. You understand?
Yeah.
So I'm not saying the HPV can potentially disappear. Mm-hmm. We have seen cases where after burning and treatment, when we screen after, the HPV no longer exists because it probably was just located in that area. But the idea is we can treat the cervix before cancer arises.
Okay. Now you said that, I have another question. For persons that develop cervical cancer, majority of them that died, was it already advanced? And 2, do we not offer chemotherapy here for that, or is it just for different cancers?
So we offer chemotherapy in St. Vincent, but the recommendation for advanced cervical cancer, once you meet the criteria, so your liver have to be working good, your kidney has to be working good, is what we call combination of chemo and radiation. So both of them work simultaneously. The chemo is given to sensitize the radiation. Oh, okay. So if you give the chemo without the radiation, the effectiveness drops rapidly.
We have radiation in St. Vincent.
Oh, okay. So that's why majority of persons have
Yes, for chemo radiation.
Okay.
Yeah.
Thank you.
We don't have And you have to remember sometimes that we don't have the chemotherapy drugs. Yes?
Okay, we have some more questions from the audience.
Yes, thank you very much. This session was indeed informative and could be life-saving, I must say as well, too. So against the backdrop of that last question that was asked, and the fact that you mentioned in your presentation that flying patients out can be quite exorbitant, I would like to know if making recommendations for our ladies in St. Vincent and the Grenadines to become a member of the Massa Life-Saving Air Ambulance Association is a wise decision, where they can save a lot of finances should they need to be flown out for radiation and to save their lives. Dr. Nichols, I'm happy, as a Massa member, I'm happy to know that you'll be answering this question. Thank you.
Obviously, we should all actually have medical insurance. I'll give you a case I had. A patient was sent to me by Dr. Charles. She was having bleeding. And I looked at her cervix and I thought the cervix looked unhealthy. So I did a pap smear and it came back showing she had cancer, early cancer. So when I was telling her, she broke down. She started to cry and I'm there trying to, comfort her. She said, Doc, you know why you're crying? It's just last week I was going to cancel my insurance. But she didn't cancel it. And that insurance was able to allow her to go to Trinidad. And she got brachytherapy and other treatment. And she actually had a child after. Yes? So I know insurance companies give us so much trouble.
Yeah.
Oh my goodness, you have to pay them out and pay them. But when it comes to, getting your money, it's, I see Miss, I see Rachel there, Pan American, all of them give us trouble.
No,
Yes,
but
the Massa.
Yeah.
So, yes, I would agree with you, Miss. We should consider getting Massa also.
Yeah, because
okay?
an air ambulance flight from here to Trinidad that you just spoke about, out of pocket, it's about 65,000 EC dollars. And when you're a Massa member, you pay absolutely $0 for that same flight. Thank you.
Okay, we have somebody else coming to the mic.
Good afternoon. I have two questions. Doc mentioned 4 different places in St. Vincent that you could go and get your HPV testing, screening. I would like to know what are those 4 places, please.
Okay, so these 4 areas are for individuals who live in that district, okay? So when you go to these areas, you have to present your ID card and you have to abstain from douching, any medication or sex for 48 hours. The 4 areas are Levi Latham Health Center, so you have to be living in the Mariaqua zone. The second is the Caliaqua district, so you have to be living in that zone. The 3 areas in Caliaqua would be the Belair Health Center, Stubbs Polyclinic, and Caliaqua. Thank you very much. And Caliaqua Health Center. That's 2 districts. The 3rd district is Georgetown. You can go to the Smart Health Clinic in Georgetown or Sandy Bay, but you have to be living in that area. And the 4th one is Pembroke, right? And that would be the Bookerman Polyclinic, and there's one more offering it. Is it Barley? Barley Health Center, I believe. So there are 2 areas in that health center, in that district. Now, if you don't live in that area and you can't afford to have a pap smear privately, you could still go to your nearest health center. Pap smears are now free throughout the length and breadth of St. Vincent and the Grenadines at the health centers. The only thing is, it would be, the medium we are using is the conventional type. That is the spatula and the slide. The liquid prep is not yet available. But I am saying this to say, if you have $0 in your pocket, there's no excuse why you can't have some semblance of screening.
Okay, from that, I have a third question. I am actually from Union Island, and you now mentioned pap smear is free, but I've done pap smear in Union Island and had to pay for it to come up here in order to get.
Remember, Doc just said 1 month ago we launched the program. So all I'm saying is effective 1 month ago.
Okay, I didn't hear that part. Okay.
Just wanted to show you on the screen what we're offering is the conventional method, which is a spatula. That's what the government is offering. Most of the private practice clinics would offer the brush. This is a little bit more sensitive because we get a lot more cells. And when you use the spatula, you have to spread it onto a slide. And depending on the thickness, you may not see as much. So there's a disadvantage. The liquid base, which is on the brush, so the cells are picked up on the brush, we actually put it in a little liquid, in a little bottle with liquid, shake it up, so it makes it easier for the cytologist to get the cells. Okay. So just letting you know that. But what we're offering in hospital right now is the conventional method. All right, and what Dr. Batiste told you about the 4 areas, it's a pilot study we are trying to do and eventually to be offered to everybody. So if you said you're from Union Island, where are you living now?
Old Montrose.
Old Montrose. So Kingstown is not offered yet because you would actually fall under Kingstown if you wanted to get HPV testing. And that's not in the pilot project. But within 6 months, we should be able to offer it to you.
Okay, final question. I've gotten my HPV vaccine in Trinidad. I want to know if I still could contract HPV and also if I should go and get tested again.
All right, very good question. So every year, or I shouldn't say every year, ever so often, the vaccines are being improved on. When vaccines were now offered, when they originally came out against HPV, they were offering vaccination against 2 strains, 16 and 18. Those were the 2 strains that were known to cause the majority of cervical cancer. As knowledge increased and more studies were done, we found other high-risk strains that were associated, and then the vaccine that protects mainly against 4 different strains were created. This vaccine covered 16, 18, 6, and 11. 6 and 11, they can tend to cause warts, right? That is what we have currently available in St. Vincent and the Grenadines. And now I'm not sure what vaccine you got in Trinidad. There's a better vaccine that was created that covers 9 high-risk strains of HPV. That's because I'm pleased to tell you,
I was going to tell you that.
we're in the process of trying to get that vaccine to offer our boys and girls and in St. Vincent and the Grenadines. No, note I said, even if you got vaccinated, we still encourage screening. Okay. If you're screening via HPV tests, if you do the HPV and you're negative, you don't have to do any more screening for another 5 years. Okay. So even though it's expensive, it costs $300, I still say you work out the maths. If you are spending $70 every year to do a pap smear, by the time you add that up, it'll be way over the $300. So for individuals who have a little extra money and don't know what to do with it, get your HPV DNA testing done. All right?
All right, thank you.
So just to confirm, the Gardner Cell 9, which is a more sophisticated vaccine will be offered next year for sure. The government is actually working on that. That's what Sister said. All right? But what we have right now is Gardasil 4. So it's still better than nothing at all. Okay?
Okay, we had another question.
Good evening, everyone. Doctors, good evening. I'm just asking because I know when there was talk about the HPV vaccine, I know some people approached me to know if they should allow their children, their daughters, to have this vaccine because of some of the things you mentioned, because some felt that, it's going to allow the children to go out early in some sexual behavior, and also to know the pros and cons, what's going to happen afterwards, the children are going to get infected. Some of them are still developing. I think you mentioned from about 8, 9, 10. They're still developing, what's going to happen to their organs, etc. So I'm not so sure if you have anything else to add to that, because people are wondering to what's going to happen. It is true, it said that it benefits preventing having these diseases as it had in Australia, but people are wondering what's going to happen to the children, boys or girls, who are just developing in terms of their organs. Thank you.
Okay, I think I was very clear in trying to, talk about the myths. Those are what we call myths, right? There's no facts, there's no evidence, there's nothing to support those concerns. I think it's just over time, people just had their fears and they start making up things to say why you shouldn't do something. Just like the pap smear, people will tell you 10 reasons why you shouldn't have a pap smear done. They will never mention it could save your life. I'm talking about ignorant people here, not y'all, right? Because y'all not going to say that. But I'm saying at the end of the day, if individuals have those concerns, it is for us to just gently, lovingly try to let them know there's no evidence that supports this sort of thinking, right? There's nothing in the data, there's no research that shows if you vaccinate your child, the child will want to have sex. Absolutely nothing. A child will want to have sex whether or not the vaccine is involved. If the child is bent on wanting to have sex, it has nothing to do with the vaccine.
Thank you. Sister Flavia, I just wanted to go back a little bit. All of us had our measles vaccine, and we never questioned, or our parents never questioned whether we should have the MMR or the tetanus vaccine. We all have it, and we have never developed measles, any of those things. All right? Right now in America, there was an article that came out this week saying that the Americas are now, they've lost the whole thing about measles because measles is rampant. We had all these anti-vaxxers coming out, and now measles is rampant in the States. Yes? Like everything else, it's new, and some people advocated, and that brought the whole program in St. Vincent down. I'm going to go back a little bit. In 2015, when we did the pilot study that Doctor mentioned, we had some high-risk strains in St. Vincent. They brought out the HPV vaccine program, and it was doing very well. Yes, they went into the schools until they got to certain areas, and the talk came about, stop the vaccination, and that just messed up the whole program. And the funny thing is, the area that needed the vaccine, that's the area that was stopped, that caused so much confusion. Yes? So I think education is what's going to help us to allow our children to get vaccinated, because we need to eliminate cervical cancer in St. Vincent. And every time I go on the ward, and you tend to know, as you enter the ward, you know we have a cervical cancer patient there, because there is an odor. It's not a very dignifying death.
Wow.
And if we can stop and educate our people and ensure that our little ones, both boys and girls, are vaccinated, we're not going to see it now, we will not be here. But in 20 years' time, we won't have cervical cancer.
Okay.
Okay? So as a teacher, you need to say it's important that we vaccinate everybody, boys and girls. And we need to, that's the message we need to carry out. We need to vaccinate. We need to get this program off the ground. And we have a lot of people hesitant, but we need to do it.
Well, thank you very kindly, because I was not sure. They were connected to me what would happen because they felt the children were not developing, they were just developing. What happened to the periods and sort of for the girls and all that too, and also, after effects, and not only the part where they mentioned about being promiscuous or whatever, but they felt that they were concerned about the organs, what would happen to the persons after, and in between, if you had enough testing done with the vaccines, So I think I told them
let's go back to measles. We give our babies measles vaccine at what? What age we give them? 10
months.
1 month, 2 months? I can't remember.
3 months or so.
2 months. Our babies grow. There's nothing wrong with our babies. All our children grow up and do well. You understand what I'm saying? We just have to, and what doctor was showing you is all the studies that have been done on the HPV vaccine and the elimination of cervical cancer in Australia. No cancers.
Because
that's what we need.
Oh, okay.
And these are first world countries that can afford for people to, if they get cancer, they have a program that will help them. Chemo, radiation. In St. Vincent, we don't have anything.
I think that's what they felt to, because these more developed countries have what it takes to have treatment if anything happens.
Well, we need to get on board and get vaccinated so we don't have to.
We need to prevent. We can't wait till we get the actual cancer. So our heavy push has to be prevention. And two arms we spoke about when it comes to prevention: vaccination and screening. The two arms must work together. Okay.
Okay, thank you.
Okay, so another question. How the treatment options vary depending on the stage of cervical cancer? And let's say, for example, a woman is past menopause. Is hysterectomy a good option as a treatment option? Yeah.
All right, so the treatment options vary for the age and whether the person has fertility desires. If the cancer is very early, like stage 1A, right, we can tend to do a cone biopsy or simple hysterectomy. If it's greater than that, we tend to do a radical hysterectomy. If it's greater than a stage 2B, right, which is where it's now spread to the areas that are just outside of the cervix. We call it the parametrium. They are filmy tissue just lining the uterus and the cervix. If it's spread to that area only, they are no longer amenable to surgical treatment, but then must have chemoradiation.
Okay, are there any more questions from the audience? Do we have any questions on social media? No? Okay, before we wrap up, I just want to allow the doctors to maybe say something in closing. If there's anything you want to emphasize, re-emphasize.
All right. If you don't remember anything, cervical cancer is preventable. And if we can prevent it, we need to empower ourselves with information and get our screening done, whether it's by pap smears or HPV testing. If it shows that there are early changes that may lead to cancer, we have lots of different treatment modalities that we could offer you and reverse the process so that you don't get cervical cancer. It may mean that you have to be vigilant with our follow-up, but at least we are preventing you from getting cervical cancer. And we have the treatment modalities here in St. Vincent to prevent cancer, but if you get it, house and land. And there's no guarantee of your mortality is still there.
I would just like to say, if there are 20 of you in here, then I am charging every one of you with the responsibility to reach your mother, your sister, your friend, your auntie, your uncle, your boyfriend, whoever is in your life and spread the message of awareness, screening, vaccination, because Dr. Nichols and I can't do it alone, and our two physician colleagues are here, which we acknowledge as well. We can't do it alone. We need every single one of you to join the fight in preventing cervical cancer in St. Vincent and the Grenadines.
Okay, thank you very much. Can you just... Oh, one more question?
So you would have to see a healthcare provider first, because they would have to take the actual smear from the... Yes, so a healthcare provider has to do it, whether it's a nurse, whether it's Planned Parenthood, whether it's a private doctor, wherever you are comfortable, they will have to take the sample for you and then give it to you to take to the lab. The labs are Sigma and CRL.
Okay, so we want to again put our hands together for Dr. Nichols, Dr. Batiste Sylvester. And I want to welcome back our marketing manager to wrap things up.
All right, good evening, everyone. I just would like to say a brief thank you, a special thank you to Dr. Batiste Sylvester and Dr. Nichols for being here with us this afternoon and sharing their knowledge and ensuring that we are aware of the options that are available to us, and for giving us the charge of being a part of the elimination of cervical cancer here in St. Vincent and the Grenadines. We say a special thank you to Mr. Kevin Weeks for streaming, our photographer, Simo Hines, NLS Sounds for audio, and to you, our audience, both here at the Teachers Cooperative Credit Union headquarters and those viewing online. We truly appreciate you taking the time out this afternoon to be a part of our 5th annual Health Symposium. I hope that your journey home is safe, and we look forward to seeing you next year. Maybe not the same time, but we'll be here, same place, and we'll be here discussing another topic. So thank you very much. And before we leave, I also want to acknowledge Mr. Stapleton and his colleague. You can have a chat with him about if you're interested in signing up for MASA, and he also has his Lviv products on display as well. So before you leave, do have a chat with him and see how he can get you signed up for MASA. We also would like to say a special thanks. We have some tokens of appreciation for both Dr. Batiste Sylvester and Dr. Nichols. We'll start with Dr. Batiste Sylvester. All right, so once again, thank you for being here. We truly appreciate and do enjoy the rest of your evening.